So I'm very excited to be here today to discuss current brain research and our brain-based approach to helping children along the spectrum and anyone who struggles with attention, behavior, socialization, distractibility. What's very important today is I'm not here to discuss a cure for autism, because autism is not a disease. Children and adults who struggle or diagnosed with autism have areas of the brain that are gifted and maturing at a very high level, but other areas that are underdeveloped. So there is a underconnectivity in certain areas of the brain. Now you're going to hear a lot today about the word connectivity, because that's really what the brain does. It's important to understand that any type of developmental disorder, whether you call it autism, ADHD, Tourette syndrome, OCD, is due to an underconnectivity in the brain. In autism specifically, and we're going to go through some of this research, there's an overconnectivity in what we call local processing. Local processing in the brain involves detail-oriented information. And there's an underconnectivity in areas of the brain that are more globally processing information, which is really looking at possibly, when we say detail information, looking at the trees, global information, looking at the forest, seeing the big picture. Now, even though we say in autism there's an overconnectivity in local processing, a underconnectivity in global processing, this is the same for individuals that are diagnosed with ADHD, with OCD, with Tourette syndrome, with sensory processing disorders, with all these types of neurodevelopmental disorders, which is why there is a huge overlap in terms of all these diagnoses. And therefore, the goal of anyone who works to improve brain health in any individual who's struggling, specifically autism, is to improve functional connectivity in the brain. So if we look at this next slide, we understand that we use the term spectrum. Being on the autism spectrum really means that an individual's brain is processing information differently. It could affect social interactions, it could affect communication skills, behavior patterns, but it's important to realize that every individual with autism experiences it differently. So there's no two people with autism that are exactly alike. One of the main benefits of using the term spectrum is that it acknowledges and validates that autism is a diverse condition. Varying degrees of severity, varying degrees of symptoms, and it recognizes that each person with autism will have a unique challenges and unique gifts. So it's, rather than labeling someone you have autism or you don't have autism, it's a spectrum of disorders. But many other diagnoses share the same traits as individuals with autism, which is why if we want to improve brain health, again, we have to address the underlying gaps in development and strengthen the brain rather than giving a label to the actual condition. So if we look at this slide on the right, we see on the bottom left at around the 7 o'clock position that most, if not all, people with any of these disorders are gifted. Sensory integration disorder, auditory processing disorders, depression, ADD, oppositional defiant disorder, learning disabilities, anxiety, Tourette syndrome, OCD, developmental coordination delay. All of these disorders are labels given to an individual if one of these specific symptoms shine out. But in general, most, if not all, of these disorders share comorbidity, which means they share a lot of the same symptoms. So I'm going to talk to you a little bit about my background. I've been researching the brain for over 30 years. I'm a chiropractic neurologist, which is a board certification in neurology, culminating in 4 years of postgraduate study. After becoming a chiropractic physician, I'm a fellow of the American College of Functional Neurology. I do have a subspecialty in childhood neurobehavioral disorders. I've pioneered the theory and development of the brain balance program, so I've been doing this work before brain balance was in existence. It was known as hemispheric integration therapy. But most importantly, I'm a parent. So my son, very smart from a literal, concrete, black and white, logical standpoint. He spoke very early. But on the other hand, there were issues with socialization, with behavior, low frustration tolerance, poor coping strategies, teachers, doctors not really giving me the answers I was looking for. So we started doing this work. And the result today is he's a medical physician and quite successful. So what I tell parents here in the center is there's light at the end of the tunnel. But let's start with the definition of brain health, because that is really what our goal here is at Brain Balance, and not only at Brain Balance, but should be the goal of any type of therapy or any type of program that really works to improve the functioning of children, teens, or adults. Brain health, and this is from the World Health Organization definition, is the state of functioning, brain functioning across cognitive, sensory, social, emotional, behavioral, and motor domains, allowing a person to realize their full potential over the life course, irrespective, regardless of the presence or absence of a specific diagnosis or disorder. So it's the state of brain health across cognitive domains: attention, organization, working memory, time management, decision-making, reasoning, which happen and occur in a very specific part of the brain, which I'll go through later. Sensory domains, how we take in and process information through the eyes, through the visual system, through the auditory system, through our skin, through our body awareness, which affects socialization, social emotional development, improving frustration tolerance, coping strategies, and important motor domains. So it's critical that we look at movement, so that when the brain starts to develop, there are typical movements that the babies go through, and this is critical for future and brain development as we go up the ladder of brain development. So we all know that, unfortunately, there's an epidemic in our society of decreased brain health in our childhood population. In ADHD, for example, 6.1 million children are diagnosed with ADHD. Special education, 15% of our childhood education, our children are in special ed with a learning disability or some type of special education. Autism spectrum disorder comprises about 2.3%. 1 in 38 children, this is from Autism Speaks, 1 in 38 children are now diagnosed as being on the autism spectrum. 10, 15 years ago, it was 1 in 10,000. Now, diagnostic criteria have improved. That's part of it, but it's not all of it. There is an actual increased prevalence in these disorders. So the total of children who are struggling in any of these areas of decreased brain health is about over 25%. And that's just the children who are diagnosed. So there's another 25% approximately that have not been diagnosed. So that's 50% of our childhood population has some form of neurodevelopmental disorders. So let's take a look at some of the research on autism. Martha Herbert, who's a professor of neurology at Harvard University, states multiple mechanisms involved in autism. There's a genetic component, an environmental component, which alters brain connectivity, nurture, and nature. Again, the term brain connectivity is going to come up a lot in this conversation, resulting in processing and connectivity abnormalities. Autism overlaps with other disorders because of commonalities in underlying pathophysiology. Like I mentioned before in the second slide, there's a comorbidity. It overlaps with many, many, many other disorders. So to just give it a label rather than look at the big picture of improving whole brain health, whole brain connectivity, is not really doing the child justice. The encephalopathic features, encephalopathic meaning the brain connectivity or the brain neuronal architecture of the brain. The encephalopathic features of autism may be treatable and even reversible. Again, Martha Herbert. Brains of autistic individuals engage in local, detail, rather than global, big picture processing. Now, we also understand that we have two hemispheres in the brain. Even though both hemispheres share a lot of the same commonalities, we know there are biases in one hemisphere compared to the other, which makes sense because it would be redundant to have both sides of the brain do exactly the same thing. It would waste real estate in the brain. And we know the left side of the brain is more involved in local detail processing based on the way the actual neurons are arranged. And the right side of the brain is more involved with global big picture processing. But at the end of the day, there's widespread underconnectivity in the brain. Marcel Just is a professor of psychology at Carnegie Mellon Institute. Again, local overconnectivity and long-range underconnectivity. Local connectivity is more apparent in the left side of the brain. Long-range global neurons and global connections are more prevalent in the right hemisphere of the brain. So, looking at some other research, Uta Frith has argued that people with autism show weak central coherence and an unusual bias towards piecemeal rather than configurational processing, and a reduction in the normal tendency to process information in context. Context, implied reasoning, cause and effect thinking, drawing conclusions. These are more right hemispheric skills. Piecemeal, detail, short range. The autistic brain tends to focus on those types of processing information. And central coherence really means how all these systems in the brain are coordinating and firing and wiring together. Frith proposes the hypothesis that the features of autism associated with weak central coherence result from a reduction in the integration of specialized local neural networks in the brain caused by a deficit in temporal binding. Temporal meaning time. So the brain fires and wires at very precise times. All these systems in the brain have to light up and fire and wire. There's a very specific saying in neurology and neuroscience that neurons that fire together wire together. So neurons firing and wiring together in time is critical for temporal binding rather than these systems being fragmented. Some of them being online at certain times, offline at other times, and not coordinating and firing and wiring in a more binding effect or more coherent effect. The visual perceptual anomalies associated with weak central coherence may be attributed to a reduction in synchronization. Again, coherence, synchronization, connectivity, that's how the brain works. And when there's an issue or problem or underconnectivity, lack of synchronization, lack of coherence in the brain, we're going to get a host of symptoms, whether it be attention, organization, social issues, behavioral issues, learning issues, dyslexia, processing. So again, the goal is to improve coherence, connectivity in the brain. Again, altered brain connectivity. Again, not unique to autism. Altered connectivity in the brain is common across developmental deficits involving sensory issues, attentional issues, emotional functioning. This was published in the Journal of Clinical Child and Adolescent Psychology. Functional connectivity of neuromotor networks is disrupted in children with developmental coordination disorder, attention deficit disorder. Going back to that second slide, all of these different diagnoses have a commonality of altered connectivity and lack of coherence in brain development. Abnormal functional connectivity in children with ADHD, that was published in the Biological Psychiatry in 2012. We also need to understand that it's not just having the brain fire and wire together, but there's also actually a hemispheric imbalance. Again, we know we have a left side of the brain, we know we have a right side of the brain. Important to understand, the left side of the brain and the right side of the brain do share a lot of the same traits, but there is and has to be a bias where the left brain has certain specializations and the right brain has certain specializations. OCD, obsessive compulsive disorder, as a functional interhemispheric imbalance at the thalamic level, published in 2011. There's a decreased interhemispheric functional connectivity in autism in the autistic cerebral cortex. Okay, so we're not just talking about underdevelopment in specific systems, but we're also talking about a lack of connectivity between both sides of the brain. Functional and anatomical cortical and underconnectivity in autism. Evidence from an MRI study of an executive function task in corpus callosum morphometry. Corpus callosum is the main highway between both hemispheres of the brain. So in order for the right side of the brain and the left side of the brain to share information, there's a highway that goes back and forth, and this is called the corpus callosum. So this study took a brain activation of a group of high-functioning autistic participants. There were 3 indications of underconnectivity: lack of synchronization. Again, all these studies go back to synchronization, coherence, underconnectivity. So again, the goal of anyone who wants to work and improve function in the brains of children with autism or any neurodevelopmental disorder is to improve synchronization, to improve connectivity. There were areas of activation that were lower for autistic children and adults than the control participants. The corpus callosum itself was smaller in individuals with autism. Again, the corpus callosum, that highway between both sides of the brain, was actually smaller in children and adults with autism, which means that the communication between both sides of the brain would not be as efficient. These findings suggest that the neural basis of altered cognition in autism results and entails a lower degree of integration of information across certain cortical areas, resulting from a reduced intracortical connectivity. Connectivity, we keep coming back to connectivity. So we need to improve brain connectivity in order for the brain to function and improve and process information in an appropriate way. The results add support to a new theory of cortical underconnectivity in autism, which posits a deficit in integration of information at the neural and cognitive level. This was published in the journal Cortex. So I think you're getting the understanding that when we deal with children on the spectrum, when we deal with children with any neurodevelopmental disorder, we need to improve brain connectivity. And we're going to discuss, well, how do we do that? So first, I want to just go through a little discussion on epigenetic factors. I know, doing this work for 25 years and meeting hundreds and hundreds of parents, hearing the MTHFR gene, and this is a trait, but I want everyone out there to understand what this really is. What epigenetic factors are actually environmental factors. So there are genetic factors where Down syndrome, Tay-Sachs disease, cystic fibrosis, sickle cell anemia. These are actually genetic deletions or genetic additions. Epigenetic factors are how the environment could actually change the way our genes turn on and off. If you look at a baby grand piano, the black box of the piano is the chromosome. The keys are the genes. And we understand that every piano has the same amount of keys in the same exact sequence, but you could play those keys a million different ways, make a million different songs, and that's what allows us to make certain proteins, and 85% of our genome is devoted towards building the nervous system. So quickly, methylation. Methylation is a process where a methyl group, now methyl group is, you see this red circle here. A methyl group is a carbon with 3 hydrogens on it. Not that you have to memorize that, but these methyl groups actually attach to base pairs, which are the basis of the genes in our DNA. And these methyl groups turn genes on, turn genes off. Mostly they turn them off. And individuals with autism may have different methylation patterns. MTHFR, which is commonly referred to in terms of these genetic issues that people with autism have, MTHFR stands for methylene tetrahydrofolate reductase. So that's a very long word. All it means is folate, which is one of the B vitamins, actually donates methyl groups so that these methyl groups could turn genes on and off. And this seems to be, in certain individuals, an issue or a reduction in this particular enzyme, doesn't mean if you have MTHFR, you're going to have autism. A lot of other factors. There's environmental factors, there are genetic factors. So people who have this type of a genetic issue might want to look into taking methylfolate. Again, folic acid donates methyl groups, B12, glutathione, which is a major detoxification chemical in the body, vitamin B6, D3. Also, you might, and during our program, and we work with children, it's a very strong nutritional component to our work. Each parent is actually paired with a nutritionist who works with them. So a lot of people discuss gluten-free, dairy-free diets because children might be sensitive to those types of proteins. Gluten mostly found in wheat, casein mostly found in dairy products. And what happens when if children are sensitive to these particular proteins, they could cause inflammatory products to be produced. It's not an allergy. You don't get anaphylactic shock, but it could cause inflammation and interfere with the pathways we're trying to establish in our program. Also, we want to stay away from artificial colors, artificial sweeteners, artificial dyes. So let's take a look at some of the early warning signs, because the brain has a typical trajectory. The brain has to build from birth. Baby starts to use certain primitive types of movements called primitive reflexes. Then they use their postural system to roll over, to sit up. Then they stand up. Then they start scanning with their visual system. So there's a typical trajectory of brain development. But if that trajectory goes off course, we're going to have signs and symptoms of many of these disorders that I just described. So typically, at 6 months, we could actually see if there's an atypical trajectory in a child. Few or no big smiles or other warm, joyful, or engaging expressions. Limited or no eye contact. We could see this as early as 6 months old. At 9 months, little or no back and forth sharing of sounds, smiles, or other facial expressions. At 12 months, little or no babbling. Little or no back and forth gestures such as pointing, showing, reaching, waving. Joint attention is critical. When at a 12-month-old should be able, if you're with a 12-month-old and you turn your head and you point to something like a balloon or any other object, a 12-month-old should actually follow you and look at what you're pointing to. So a critical aspect or a red flag is when children are showing no joint attention, and also little or no response to their name. Also repetitive behaviors, which we call release signs. These are common in other conditions as well. Stimming, rocking, running back and forth, running in circles. These are releases. Because when you have an imbalance in brain development, and we understand that certain parts of the brain are activating, other parts of the brain are calming, but when all we have is activation and no calming part of the brain, which is an imbalance, we're going to get a lot of activation in movement, thought, emotions, which I'm going to discuss shortly. So again, it all goes to underconnectivity in the brain. And when we see underconnectivity in the brain, we can look at a lot of these different symptoms. And these are all signs of what we call developmental gaps. The reason I mentioned that term developmental gaps is because really when you look at children and you want to improve brain health and improve brain connectivity, you have to go back as far as you can in development and see where are those gaps, where are those weaknesses which would not have allowed a child to have good connectivity and good synchronization in the brain. What do developmental gaps look like? Meltdowns, low frustration tolerance, poor attention, hyperactivity, impulsivity, host of learning disorders, defiance, oppositionality, a lack of coordination, social challenges, not picking up on body language, eye contact, inflections in voice, certain behaviors. So these are signs of developmental gaps. Now, to really understand how this works is we need to look at what we call brain hubs. These are very fascinating research that has come out, and we need to understand that the brain is made up of billions of neurons making trillions of connections. What we're looking at here is a side view of the brain. So the left side of the screen here in red is known as the frontal lobe, which is the front part of the brain. And the back side here is more of the visual part of the brain. However, if you look at these dots, what these dots are called are hubs. So think of an airport where all the planes come in, it's called a hub, and then all the planes go out. Well, it's the same concept. These dots represent areas of brain where neurons are coming in, sharing information, and then they send out information to other hubs and to other hubs. So you see, if you follow all of these hubs and all these lines, every single hub influences every other area of the brain. And they all end up giving this front part of the brain information. This front part of the brain is known as the executive, or the frontal lobe. The executive of the brain, attention, organization, time management, decision-making, social ability, motivation, behavior, frustration tolerance. So if any of these areas are underdeveloped, you could see how it will influence the ability of the executive to do its job. So we use the term bottom-up development is critical for top-down control. What I mean by bottom-up development, again, is we have to go back as far as we can in development and see where were the roadblocks, where are the developmental gaps that would not have allowed this top-down control to take place as efficiently as it should. We even go back as far as looking at the brainstem. That's the bottom of this picture in gray. The brainstem is where we house developmental reflexes, or what we call primitive or developmental reflexes. All babies have developmental or primitive reflexes that allows babies to see, feel, taste, touch, interact with their environment. One of the cutest things we see as parents is when our children are very, very young and we put our finger in their hand, they grasp it and they hold on to it. That's called a grasp reflex. But there are many, many other primitive reflexes that are involved that sets the stage for movement, eye tracking, postural control. So if children have retained or non-integrated primitive reflexes, well, this is a red flag of future brain trajectory of the brain not taking its typical course. So we have to look at these. We have to look at motor skills. We have to look at the visual system. How is the child processing visual information? How are their eyes moving? How are their eyes tracking? All of these systems, how are they feeling their own body? Sensory processing through the eyes, through the ears, through the skin, through the body. Being able to feel your own body. Being able to be aware of your own body, which is critical for body awareness, for self-perception, self-awareness, self-realization. How is the brain synchronizing? How are all these areas of the brain connecting, firing, wiring together? And cognition, looking at attention, working memory, visual spatial abilities. So if you're not looking at all these different areas, then you're really missing critical areas that could be strengthened and connected so that we could have this excellent top-down control. Top-down controls allows us to focus, have attention, be able to have us have better frustration tolerance, coping strategies, emotional regulation, memory, learning, being able to inhibit thoughts, being able to, if a child wants to scream out in class, a properly functioning executive system will say, I really want to raise my hand and scream out, but I know it's not appropriate. So this is what happens when the brain is maturing in a typical trajectory. Not only do we have bottom-up development, which is this bottom arrow, but there's also horizontal integration. So the way the brain grows and the brain matures is that if we look at the brain as a flower, we understand that the flower first grows a stem, but then the flower starts to sprout. Well, that's exactly what happens in the human brain. First, we have bottom-up development, but then we have horizontal development between both hemispheres of the brain. So it's critical not only to improve developmental gaps from the bottom up, but also to look at hemispheric connectivity in the brain. And again, if we remember, the left brain more involved with local, detail processing, right brain more global, visual spatial processing, and many, many other more traits, which I'm going to describe now. Very important to realize, both sides of the brain do many of the same tasks, but there is a specialization between one side of the brain and the other side of the brain. For example, left hemisphere, attention to details, like I mentioned, local processing. Right side, more attention to their surroundings, visual spatial, global attention. Left brain, facts, events, literal, concrete. Approach, initiation behaviors. Approach behaviors are more movement, activated behaviors, whereas the right brain is more about inhibitory control, inhibiting your thoughts, inhibiting actions, inhibiting behaviors. But if we don't have good connectivity or underdevelopment in this area of the brain, then we're going to have a lot of approach behaviors, activation in thought, activation in movement, activation in emotions. Logical analytical thinking as opposed to big picture thinking, more numerical operations, literal, addition, subtraction, multiplication, as opposed to more word and math reasoning skills. So we understand there is a difference between the left and right side of the brain, and the brain has to be likened to an orchestra. You can have 100 musicians on stage. The brain is designed to work the same way as an orchestra. Performs different functions just at the right time, the right speed, the right tempo, in harmony. If you have 10 to 15 musicians that are playing at the wrong time, the wrong speed, the wrong tempo, you're going to walk out of that concert. That's a lack of connectivity and a lack of synchronization in that orchestra. The brain is the same way. When areas of the brain are weaker than others, like an out-of-tune orchestra, the result is evident in the child's various behavioral, academic, social, and other difficulties. So let's take a look a little more microscopically and see what we're actually looking at. The brain is made up of billions of these neurons. A nerve is like a tree. You could have a tree with a lot of thick branches and a lot of roots on the left, or very few branches and very few roots on the right. Well, the nerve on the left could receive and send information very efficiently and very quickly. The nerve on the right cannot receive information appropriately, cannot send information appropriately. The nerve on the right gets overwhelmed or reaches what we call its threshold very easily. But the beauty about the nervous system is that with appropriate stimulation, that's intense, that's progressively challenging, we could actually have these nerves grow more branches. And that is the basis of neuroplasticity. And that's what we're trying to do with every single child we work with, is to target underdeveloped areas, developmental gaps, and specifically strengthen these systems in the brain by having it be progressively challenging. Looking at the brain in a different way, what we call a developmental pyramid, what we want for every child is good synchronization and good connectivity in the brain. That's the goal. But we have to go back as far as we can in development. We have to look to see, have all primitive reflexes or developmental reflexes been integrated? How are these sensory motor systems functioning? Body awareness, visual systems, auditory systems, processing systems. And then we have ways of assessing synchronization in the brain. So the goal is a bottom-up approach. A top-down approach would be more tutoring, medication, psychotherapy, 504 plans, IEP plans. Don't get me wrong. There's nothing wrong with all of those plans. The problem is that if the bottom up is not maturing correctly, the child will not be functionally capable of benefiting from those other types of programs as efficiently as they should. So it's a synergistic process. It's not one or the other. So what is brain balance? It's a multimodal approach. We look at many, many different brain systems, and our goal is to enhance bottom-up development, and don't forget horizontal development, so we could have good top-down control. And the result is improved maturity and integration in functions. Again, there's nutritional recommendations that we recommend: clean, healthy eating, nutritional support through our nutritionists, certain supplements we recommend. Obviously, it's drug-free. We don't administer medication. It's integrative. We use sensory stimulation in many different ways, through the eyes, through the ears, through the skin, through the body, physical types of stimulation, cognitive stimulation, nutritional advice. So we are targeting all these brain systems so they all start connecting and improving brain connectivity. There's been a lot of research done on our work over the last 5 to 10 years. This is just a smattering of it. There's a lot more. Humanities and social sciences and communications. These are all peer-reviewed literature showing in this particular study, a majority, or 81% of people demonstrated improvement on the Brown's ADD scale. The Brown scale is an ADD scale. It's a checklist. It's subjective. Psychiatry research, Harvard did a study on our work at the Department of Biopsychiatry. Dr. Martin Teicher, who heads up the Department of Biopsychiatry, did a excellent study using the Brain Balance program in a virtual setting, where they found the results were more consistent, predictable, and reliable than low-dose methylphenidate, which is important. There were functional MRIs done in this study, where functional MRI really shows the activity of the brain, the electrical activity of the brain, how blood flow is moving in the brain. When areas of the brain are working, blood is shifted to those areas, and functional MRIs are able to pick up which areas of the brain are firing, which are not. And they found that after a 15-week home version of this program, which is not as specific, as intense as what we do here in the center or what we do in our at-home virtual program, they found these results, again, were more consistent, predictable, and reliable than low-dose methylphenidate. And there were a number of other scales that showed improvement. Journal of Mental Health and Clinical Psychiatry, Journal of Study. And you can see all of these studies on our website if you go under research. But the research is there. The work is effective. So the way the program works is that every child in our program has a comprehensive assessment. It takes about 90 minutes looking at all these different brain systems. We review results with parents. If parents decide to work with us, we have an introductory meeting, which is called a welcome meeting, where we allow the parents to have access to our portal, which has a wealth of information, supportive material, nutritional material. Children get what we call a gear up kit, where we have children do work at home, and they have different types of equipment that stimulate the visual system, the tactile system, the olfactory, the smell system, the auditory system, to keep the brain activated when they're not in the center. Again, nutritional initiatives. Children could work in our center, and each session is about 90 minutes. We also have a virtual program where children and parents could do this work at home. You are set up at home to do all this work. You get all of our proprietary software. You get equipment sent home. You have a virtual specialist who works with you. There are hybrid modalities where children could come in the center and also do the work at home. Exercises are done when the child is not in the center. We have progress reports every 12 sessions to keep the parent abreast of how the child is progressing. We advocate for children in the school system. So we speak to schools and teachers, and this is really fascinating to a lot of these school systems, because what they're used to seeing is child has ADD, the child has learning disability, the child has dyslexia, the child is disruptive, but we're giving them really the underlying cause of why these children are struggling. And they realize many, many, many times the child is not in control of this. And we want to give the child back control of their own brain. When we're finished with the program and the child reaches their goals, we do another assessment, and then they go into phase 2, which are follow-ups with the parents. every month or every 2 months. We give the child, depending on the case, activities to do at home to maintain the gains we've made with them, and then they come back a year later. So really, if you want to find out if this is the right program for you, there are many ways to do this. You could schedule an assessment, you could schedule a tour or a consultation. Consultation and tour are free. Now, a regular assessment in our center is $295. Any parent who wants to call and have an assessment, if you mention this webinar, that price would be $145. But this is not all centers. So there are a lot of other centers and a lot of other people listening to this webinar in different states. So you would have to check with your center to see if this would apply to your center. But again, how would you know if there's underconnectivity, gaps in skills and behaviors, inconsistency or fluctuations in skills, behaviors, learning, or emotional regulation, and increased challenges in paying attention, managing mood, reactions, learning, and social interactions? So all of these are signs of underconnectivity or developmental gaps or a lack of appropriate trajectory in brain development. So I'll open this up to any questions. Sam Solomon, our program director, is standing by to ask if there are any questions. She'll field those questions for me.
Hi, yes, I am. So we are currently...
Hold on 1 second. All right, Sam, I didn't hear any questions.
That's okay. Can you hear me now, Dr. G?
Yes, I can hear you now. Sorry about that.
Okay, perfect. So we are live on TikTok and Instagram and on Google Meet. So we've got people asking from a few different places. So I'm gathering some information, but please feel free to continue to write questions in either the TikTok chat, the Instagram chat, or here on Google Meet. So that way we can get to everybody. A couple questions that I have so far. Someone asked, or someone actually just said, I knew identical twins once, and one had autism and the other was neurotypical. It was very interesting to see one strongly presented in one and not at all in the other. Can you explain why something like that might happen in development?
That's a great question, and there's a lot of studies done on that. So that goes back to the epigenetic factors and the environment that the babies are developing in. Now, you would think they're identical twins, they have the same genetics, but actually in the womb, one baby might be getting a different blood supply or more of a blood supply than the other. The other baby might not be getting the same blood supply and nutrition than the other. So there are epigenetic factors, in addition to genetic factors, that could have one child manifest in developmental gaps or autism where the other child will not. And this has actually been documented in a lot of the literature.
Awesome. Thank you so much. And another question, can somebody stop being autistic?
So, okay, so that's a very good question. Autism, again, is not a disease. Can you stop being autistic? Autistic individuals have gifts and certain areas of underdevelopment. What I'd like to answer that question with is this comment. Autistic individuals who have underdeveloped areas of brain function can absolutely have these underdeveloped areas be strengthened and improved, and have improvement in connectivity between both hemispheres of the brain. Every child or adult with autism is different. So people have their own personalities, but my goal would be, and anyone's goal would be, to improve connectivity in the brain, which could absolutely improve a child or an adult with autism. I will tell you, we used to do the Gilliam Autism Rating Scale. We don't do it anymore. But there were many, many cases, and this is subjective, where that scale would show over a T-score, which would be on the autism spectrum. And after doing this work, the autism rating scale would show that the individual did not meet the criteria for autism. That's how I'd like to answer that question.
Okay, great. And I have a question here. How long has brain balance been around?
Well, brain balance has been around now. Well, I've been doing this for about 15 years. I'd say about 18 to 20 years now. The brain balance program has been given to children throughout the United States.
Okay, great. And let's see, how is autism different in children versus adults?
Autism is really not different in children and adults. The difference between a child and adult's brain is that a child's brain goes through growth phases. If I go back to this slide, what a growth phase is you see these branches. In a child, these branches sprout. They sprout like a hedge or a bush will sprout. And then we have sprouting, and then we have like trimming of a bush. You would trim a bush. So adults don't go through sprouting. A child's brain does go through growth phases. But how is it different than a child and an adult? If nothing is done and the child turns into an adult with autism, you could still see the same types of symptomatology in a child as you would in an adult.
Okay, fantastic. And I have questions coming up from a couple of places, so please feel free. Again, I'm just reminding everyone who just joined the call. I think Kat just joined on the Google Meet, so please feel free to type your questions in the chat box and I'll get to them as soon as I can. Next question I have is, have you ever worked with a nonverbal student or a low verbal student, and have you ever seen improvements there?
Actually, we have worked with children who have nonverbal autism or selective mutism, or children who are nonverbal. We just finished with one who showed significant improvement in verbal skills. So again, when we talk about nonverbal students or nonverbal individuals, we're talking about pathways in the brain that are not coordinating, that are underdeveloped, that these pathways are not connecting the way they should. So by improving connectivity in the brain, we're waking up certain pathways. So the answer to that is yes. We have worked with students who are, quote, nonverbal. These students are very bright. When they're given certain accommodations, they're able to express themselves very easily. But I wouldn't say every single nonverbal child who has nonverbal autism is going to start speaking after going through this program. So every child is an individual. Our goal is to improve brain connectivity. And many times when you start to wake up these areas of the brain, those speech, expressive language systems and receptive language systems start to connect more appropriately.
Okay, and Diana asked, hello, Dr. Goldenberg. I wanted to ask if the program assessment includes a scan of the brain. I previously learned about gray matter in Westport and the imaging of the brain. Is that something similar to this work? Also, does the program use laser therapy?
No, so we don't use low frequency or cold laser therapy. And as far as doing a QEEG, which is what you're describing, we don't do QEEG. And in all honesty, when you do a QEEG, you're getting activity in the cortex of the brain, which is, I don't know if you guys could see this, but this is the cortex. Cortex means shell. You're getting activity in the cortex. You're not getting information about primitive reflex integration, sensory systems, motor systems, visual systems, auditory systems. You're getting a global information of activity in the brain, and that brain wave comes from a part of the brain known as the thalamus. The thalamus is the hub of where all sensory information from the body and the environment comes into this hub and sends it to the cortex. So that's what the QEEG is showing you. It's showing you the electrical activity in the brain. However, if you're not addressing all these areas that are feeding information to the thalamus, then you're missing quite a bit of information.
Okay. And then I have a couple of questions about like autism in the classroom and autism in school. Really just asking, what does school look like for an autistic child? And how is it different? And how can we better support them in the school system?
That's a great question. And as I mentioned in the very beginning, every child diagnosed with autism is totally different. So there are some children with autism that are in a regular classroom and receiving regular instruction, possibly with an aid, possibly not with an aid. There are children more severe on the autism spectrum that needs to be put in a contained classroom because of severe behaviors. So that question is really dependent on how that particular individual is expressing or presenting with their symptoms. It's not one answer. It's not a one size fits all answer. It depends on the child, depends on the PPT or the CSE meeting, or well, in different states, it's different things. It depends on the IEP meeting and what the child is presenting with, and what the school system has available to help these children. Sometimes it's an aid. Sometimes it's a device that allows the child to express themselves more efficiently by typing their thoughts out. So there are a lot of different ways which school systems can work with children on the spectrum. But again, it's not one size fits all. Depends on the actual individual.
Okay, and then this is one of the last ones that I'm seeing, unless something comes through before we end the call here. But in what way can I help my child with sensory seeking behavior or sensory sensitivity? They are sensitive to textures, smells, taste, things like that.
Right. So first of all, everyone is available to have this handout that I have here. It's called Optimizing Brain Connectivity Through the Senses. So this last question is a perfect segue into getting this actual handout that I could give to everyone. You could just email me at norwalk@brainbalancecenters.com. But why do children have tactile defensiveness? Why do children get bothered by certain sounds? Why do children get bothered by certain smells? Because typically, in a typically developing brain, the brain filters out unwanted stimulation. Just like the computers have filters, capacitors, resistors. But when you have an imbalance in brain development and you have developmental gaps, those systems are not maturing correctly. So the child is smelling something way out of proportion. It's called hyperosmia. Typically, we're not thinking about our collars or our cuffs because the brain is actually inhibiting these sensations because they're not a priority. But when we have an imbalance in brain development, all this is getting up into the child's brain. And you can imagine how frustrating that is for a child to go through a day when they have to think about all these things, when they still have to learn, they still have to come home, they still have to socialize, they have to navigate through the hallway. So the way to help children with these types of struggles, you could absolutely get this handout. But really, at the end of the day, instead of giving an accommodation or a modification like headsets or certain types of textures on their skin, is to really improve connectivity in the brain.
Okay, and I actually do have one more question that came through while you were answering that one.
Yes.
How is brain balance different than ABA therapy?
Oh, well, it's quite a bit different. Brain balance works on going back as far as we can in development and filling in developmental gaps using many types of physical, auditory, sensory, movement, timing activities, focusing on the weaker systems in the brain. I'm not holding myself out to be an ABA therapist. I want to make this clear. But I understand that ABA therapy is really more of a top-down approach, working on the cognitive brain, reward systems, teaching a child how to behave, how to sit, how to eat, how to socialize. It's very hard to teach somebody consciously something that should be learned unconsciously. Socialization is an unconscious skill that's learned from birth by picking up on inflections in voice, by picking up on facial expressions, by picking up on people's body language. And that sets the stage for that right hemisphere to understand what's appropriate, what's not appropriate. So it's very hard to teach these skills. Brain balance really works more from the bottom up, whereas ABA therapy is a totally different modality, which really, and again, I'm not an ABA therapist, but I've been around for a long time. Really kind of just teaches the child through different rewards or different types of activities to behave in a certain way, I'd like to say. So quite a different process.
Yeah, absolutely. Okay, so I think we've answered